Republicans are expected to vote next week on whether to begin debating a health care bill now. But right now, it's not clear what will be in that bill. Senate Majority Whip John Cornyn was asked yesterday if Republicans would know beforehand what they'd be voting on. He said, quote, "That's a luxury we don't have." Shannon Pettypiece is Bloomberg's White House correspondent. Shannon, good morning. So why don't they know what bill they're going to be voting on?
Because Republicans haven't been able to come together on any consensus about what they would like to do. There's a couple options out there now. One would be flat out repeal Obamacare with a delay for 2 years to give them a couple years to come up with some sort of replacement. There is a bill right now with a replacement option. As of last night, that replacement option still didn't have enough votes. There's some amendments that could be added on to that replacement option that could maybe help bring some people on board, but there's still no pathway to 50 votes right now, yet they're still planning to have a vote next week, and the president is still pushing them to have a vote next week.
Likely without John McCain. Without
John McCain, and they can lose no more than 2 votes, so this is a fine needle that they have to thread here in order to get this bill passed. We already know Susan Collins is a pretty hard no, Rand Paul is a pretty hard no, and then John McCain, unless there is some change at the last minute where he's able to get back and make a vote.
And either way, these bills, whichever they choose to put a vote down for, are not popular. We have CBO reports suggesting that 15 million people, according to the Republican plan, at least, will lose insurance by next year. Isn't that fundamentally the problem, that these are not popular bills, and these Republican senators know that?
They're not popular with the public. They're not popular with their base. They're not popular with members of Congress. Yes, exactly. The House was able to get this passed, and a lot of members had to hold their nose there and just pass this because they hoped the Senate would do something to fix it. Well, here we are at the Senate. There's not many more safety checks or guardrails ahead. Whatever you vote for is likely going to become law, and that's the fate that they're facing right now that they don't like.
But what is interesting with the president is he is interested in making a deal. He wants a deal on this, right? And he was involved in the House talks. There was a lot of reports that he was sort of standing the sidelines in the Senate discussions to begin with. Now he's involved again, telling them potentially don't take your break. How much is that nudging and elbowing with Dean Heller and others affecting what's going on right now?
So I was in part of this luncheon they had earlier this week with the president and members of the Senate. It was the first time I really saw him make a sales pitch for this bill, not just saying this is a good bill, this is a good start, and then secretly calling it mean when everybody left the room. He was actually making a sales pitch, talking about the taxes it would remove, talking about the changes to Medicaid, the entitlement reform that it would do. He really seemed engaged, but too little too late may be the case, because as you're pointing out, the messaging and the story about this bill is already out there. 22 million people would lose coverage according to the CBO score. They are struggling to get the message under control and on their turf, and I don't think in the next week or 2 weeks they're going to be able to convince enough people that this is a popular bill to move forward on it.
President Trump promised during the campaign no cuts to Medicaid. But doesn't just about every Republican plan include cuts to Medicaid?
It does. That's the one thing the Republicans seem to have some sort of consensus on, whether or not. Now, how much do you cut Medicaid?
Those on Capitol Hill.
On the Hill, yeah. How much do you cut Medicaid? How do you cut it? But there's a view that Medicaid is an entitlement, that we need to reform it. The program's gotten too big. We need to put it on a major diet and reel it back in. But if you do that, however you shake it, certain millions of people are going to lose coverage, because 1 in 5 Americans are on Medicaid right now. 2/3 of people in nursing homes are on Medicaid right now. If you cut that program, you're going to be affecting some of those people.
A lot of pressure on Mitch McConnell. The question is the president helping or hurting him? Thank you so much for joining us, Shannon Pettypiece. Sunday on Face the Nation, John Dickerson will speak with 2 Republican senators, Susan Collins and Maine's John Barrasso of Wyoming. Susan Collins, of course, of Maine, and John of Wyoming. That's Sunday here on CBS.